Good morning and welcome to the Haven Financial Group radio show. I'm Larry Colvig, founder and CEO of the Haven Financial Group. Thanks for listening this morning. We got Glenn Ramey on today on the healthcare piece of retirement, a big expense that people oftentimes underestimate. So feel free to give us a call this morning, 612-504-8400 or havenfinancialgroup.com. You can see all the classes. Again, this week we had some very well-attended classes and upcoming classes that you might want to attend. Education is power, and we're very big believers at Haven Financial Group that we want people to make educated decisions, and that starts with learning about all of these different topics. So, Kim, good to be with you once again.
Thank you, sir. It's great to be with you, and it's always terrific to have Glenn with us. And we know that he is going to talk to us a little bit about insurance costs and retirement. The theme of our show today is health, happiness, and retirement. And, I think that being healthy and having a healthy plan meet you happy. And then, of course, there we are. We find ourselves in retirement. Some of the segments that we're going to talk about, as we mentioned, Glenn's going to be here to talk a little bit about the costs of your health. We'll talk about living healthy and saving money. Coming up in our second segment, adjusting to retirement lifestyle. That's an interesting one, Larry, I always think, because I think a lot of people are so caught up in making sure they're ready to retire, they forget, are they actually ready to retire? And that's got nothing to do with their finances. It's a lifestyle change. And then finally, how stable finances can make a healthy and happy retirement. So today we're going to get started with that healthcare piece. Boy, that's an important one when it comes to retirement, isn't it, Larry?
It is. And I mentioned underestimated, very much underestimated, the costs associated with it, making the right decisions. Just when you figure healthcare out, Medicare, then they change the rules and they continue to change. Every year there's some changes, and it can be very difficult to navigate, especially for the elderly. And one can choose to do it by themselves if they want to, but they don't pay anymore if they go to an independent broker that has a non-biased approach. And I mean non-biased, that they're not going to try to sell them and lead them into something just to sell them something. And that's
Sure.
where we see mistakes made. And again, it's good to have Glenn here because he does have a non-biased approach, him and Isabel in our office. And we're very blessed and fortunate to be able to help a lot of people in the healthcare field in making these decisions. So glad to have him here on this first segment.
Well, Glenn, let's talk about the fact that, healthcare costs really are some of the biggest expenses that we face in retirement.
100%. And one of the most unplanned for expenses that we face in retirement. People often forget that it's not just the monthly premium that we're exposed to, right? It's the cost of our out-of-pocket limits, the cost of our medications, or even more so, the cost of care not covered by our health care. Right? Like long-term care costs. Sure. That really, I think, blindside people in retirement that are preparing for it.
So a lot of people, I think, just think, well, I'm going to get to retirement and I'm going to begin to work through the Medicare system and I'm not going to have to worry about it. And that's not exactly how it works, is it?
No, not at all. Especially when it comes to our out-of-pocket cost, right? So individuals that are on Medicare are going to choose between two different types of Medicare plans. Medicare Advantage plans, referred to as Part C of Medicare, or Medicare Supplement plans. In simple speaking, Advantage plans are going to be less expensive on the premium side, but you have a higher exposure to out-of-pocket limits that if we aren't prepared for a chronic healthcare condition to come up, which might mean we're going to meet those out-of-pocket limits every year for the remainder of our life, right? Did we incorporate that cost into our budget and income planning for retirement? And I'll tell you, a lot of people aren't. They're only looking at what is the monthly premium I have to pay and not the exposure to the medical bills I have to pay. Yeah, on the supplement side, we can be paying a higher premium and have a lot less out of pocket on the medical bills, but we're also going to face annual premium increases, right? How we incorporate that inflationary metric to the healthcare premium cost that often outpace normal inflation.
Sure, absolutely. Let's kind of walk through. I mean, this is a very complicated subject, and we're just going to do just a little bit of the cursory info here. And then, folks, if you have questions about this, Glenn is there in the office, Isabella is there in the office, and you can call the folks at Haven Financial Group, set up an appointment, and get into more specifics related to your health care and retirement. 612-504-8400 is how you go about that. It's the ABCs of Medicare. So maybe you could just walk us through the ABCs of Medicare, Glenn.
Yeah. So the part A of our Medicare benefits, we'll start there, right, are the inpatient benefits of Medicare, those that pay for hospitalization, skilled nursing facility for inpatient rehab, as well as hospice and home health care fall under part A of Medicare. And one thing Larry knows that I mention in every Medicare class we talk about is the fact that part A, it actually called a limited benefit health plan. That Medicare by itself, without the Advantage or supplement insurance in place, could leave us responsible for paying the full cost of a hospital stay if we're, God forbid, in the hospital for too long. And right now, that cutoff would be after 150 days. On the 151st day, Medicare would say, now we are responsible for 100% of the hospital stay unless we have that Advantage or supplement plan that's helping pick up that cost for us in that circumstance.
Sure.
Yeah.
All right. Then we have B.
Yes, part B, right? Part B are outpatient benefits in the simplest terms I can give, right? Our doctor appointments, our testing, our outpatient procedures, as well as durable medical equipment and ambulatory services that fall under that Part B benefit. And either we're going to have exposure under a Medicare Advantage plan to co-payments or co-insurances for those services until we meet that out-of-pocket limit, or we're going to have a supplement plan that covers those costs for us in that circumstance. But again, with Medicare by itself, like I was highlighting with Part A and Part B don't have out-of-pocket limits associated with them by themselves. We need this other insurance, this Advantage plan or this supplement plan, I like to say, to fix those problems in Medicare and limit our exposure to those medical bills to a defined dollar amount.
Absolutely. So that's what fills the gap.
Yeah, exactly. Exactly. That's why they call them Medigap policies in some circumstances.
Sure. And they change. And again, this is another really important reason for people to talk to experts like you, Glenn. They're different and the costs are different in every state.
At 100%. And not just that, there are rule changes like Larry mentioned. So I'll use one example. This year was the first year Medicare drug plans, Part D, that Part D benefit, right, had an out-of-pocket limit associated to them, where today a drug plan has a $2,000 out-of-pocket limit associated with it. Prior to that rule change, there wasn't an out-of-pocket maximum. And I'll share an extreme scenario I had with a client of mine who's dealing with cancer, having to take an anti-cancer medication that retailed at $16,000 per month. And even with insurance, because there was no out-of-pocket caps at that time, he was out of pocket $9,000 per year in medication cost alone, not counting his premiums, not counting his doctor bills, just the medication cost, right? Did we prepare for that cost when we did our income planning and retirement? And I say most people aren't thinking about that, right?
Of course not. Yeah, absolutely. So we've talked about the ABCs, and again, there's lots more details associated with that. But let's talk about deadlines. There's a lot of deadlines, and there's a lot of dates that you need to address when it comes to Medicare.
Yeah, I'll cover three really important ones, right? The first one is going to be called our initial enrollment period, right? This is us turning 65. And Medicare starting on the birth month that we turn 65 in. The first of that month would be that earliest starting date, with one exception. If we're born on the first of the month, they'll let us start a month early. But the rest of us, it'll be that birth month. And Medicare is going to give us a 7-month enrollment period, 3 months before that month and 3 months after it, to all of our Medicare in order, without fearing that we're going to be late or pay penalties. So there's the first one. The second one is going to be a special enrollment period for those that might delay Medicare, right? We might still work past 65 and have great health care from our job. And if our benefits are credible for Medicare, we're allowed to delay our Medicare if we want to maintain on those employer policies past age 65 and not take Medicare. Maybe we want to continue to fund health savings accounts while we're working, right? And again, we'd be able to do that if we didn't have that Medicare component in place. But when we leave that employer, we're given a special enrollment period, 63 days to get a prescription drug plan in place after our benefits stop, and 8 months to get everything else of Medicare in order without being late or paying penalties. And then the last one that's really important to know about is the annual enrollment period, the review time. For those already on Medicare, October 15th to December 7th, that opportunity to shop our Medicare plans. And this is where I'd say many people are missing opportunities for savings and shopping their Medicare plans based on their changes to their medications and changes to their medication plans. The average savings that's being missed out on is $700 a year in savings by people not shopping out those Medicare plans at the end of the year, that October 15th to December 7th window.
Well, I think we get comfortable. It gets easy, and that's a lot of work each fall to have to do so. Absolutely. We're jumping around just a bit, but because of time purposes, long-term care.
Yeah.
I know you have some stats about that. And again, these are all issues that can be taken up with our friends there at Haven Financial Group, folks. We're just jumping around a little bit to just give you a sense of some of the things that you need to be aware of. So talking about long-term care.
Yeah. So they would project that in our retirement years, we should be expecting close to $300,000 now in healthcare costs that are not covered by our health insurance plans. And this is a lot of that long-term care stuff, right? The home health care, the assisted living facilities, and the nursing homes, right? And yeah, I've got some statistics. 70% of us will need some help before we pass away. 50% of us will spend time in the nursing home, and the average is just about 3 years, right? Are we preparing for what today in our state is a $10,000 median cost per month to be in a nursing home facility, right? $120,000 a year with the average stay of 3 years, $360,000 in cost. Have we built that into our retirement plan when we're planning? And if not, that's where that risk and liability comes into play.
Okay. So Larry, again, folks can call, make appointments, and get a whole lot more information from you guys. They can even attend some of these wonderful educational seminars.
Yeah, we teach, Glenn mainly teaches Medicare Made Simple classes. Go to our website, see when those dates are. I'd be remiss in this healthcare segment to say we didn't cover HSAs, where I know we're up against the clock, but HSAs, health savings accounts, so important. Utilize them. They're powerful. And if you're not contributing and not maxing that out, you're going to really wish you did. Glenn mentioned long-term care. None of us like to talk about it, so most people don't talk about it. And then they find themselves like Michael, who recently, one of my clients, checked his wife, Kathleen, in. And he comes in and he goes, he had an invoice for $15,000 for the first month. They hadn't talked about it. They hadn't prepared for it. Unfortunately, we lost Kathleen in a very short amount of time, but that's part of the spend down process. It can decimate hard-earned work that we've done and the monies that we've worked all our life. If you haven't at least entertained or been educated on what long-term care options are out there, you owe it to yourself. Sit down with Glenn or Isabella and have the conversation. Have it at least with somebody, and we'd be honored to be one of those folks to be able to sit down with you.
612-504-8400. That's how you set up your appointment. Go in and meet with the folks at Haven Financial Group. Glenn Ramey, thank you. Thank you so much. You're always so informative. Really appreciate it.
No, my honor to be here with you guys.
Well, we appreciate you being here. When we come back, we're going to talk about living healthy and saving money. This is the Haven Financial Group Radio Show.